Bismillahirrahmanirrahim. I'm Dr. Nizamuddin Uthmani and I'm working as Assistant Professor in the Department of Pharmacology, Khyber Medical College, Peshawar. I am basically a consultant physician and pharmacologist. I am teaching pharmacology and I'm practicing medicine and gastroenterology. Today we are going to discuss another very important antibiotic, and that is the chloramphenicol. What are the learning objectives for today's lecture? Describe the chloramphenicol, describe its mechanism of action, then describe their clinical uses, and then describe their adverse effect, and of course explain the mechanism of resistance to this particular antibiotic. You know, chloramphenicol is primarily a bacteriostatic type of antibiotic, but at high concentration it can work as a bactericidal antibiotic as well. What is the mechanism of action? It's basically disrupt the bacterial cell protein synthesis mechanism by binding with the 50 subunits of the ribosomes. It stops the further division of the bacteria by blocking their protein synthesis, and thus they work as a bacteriostatic antibiotic. It also blocks an enzyme what we call as the peptidyl transferase. By blocking this enzyme peptidyl transferase, it stops the initiation process for the bacterial protein synthesis. You know, it's a very good antibiotic and it has got a very broad spectrum activity against so many microorganisms, especially the Salmonella, the Influenzae, the pertussis, the Klebsiella, the Neisseria, meningitidis, and few anaerobes. But nowadays we are not routinely used, but we are using this drug only for the treatment of enteric fever if it is not responding to other drugs. Otherwise, it has got a number of adverse effects. That's why it is not routinely used. Regarding the pharmacokinetic, the PK of this drug, it is absorbed orally as well as the parenterally. It is also used topically as well. It is widely distributed throughout the body. Primary metabolism occurs in the liver, and it is excreted in urine as well as in the bile. What are the clinical uses of this drug? This drug is used for the treatment of enteric fever. It is used for the treatment of eye infection like conjunctivitis, like stye. It can be used for the otitis externa in the form of the ear drops. It is also used for the treatment of anaerobic infection along with the metronidazole, and it is also used for the treatment of brucellosis. We use some tetracycline in other drugs, but this drug is also used for the brucellosis. And you know, because of the severe adverse effect of these drugs, it is nowadays limited. Its use is only limited for the use of enteric fever because it has got multiple adverse effects, and that's why we don't use it systemically most commonly, but topically we use it in the eye as well as in the ear infection. So it's available in the eye drops, it's available in the ointment form, it's available in the ear drops, and it's available in the form of capsules. What are the adverse effects of this drug? You know, it can cause hypersensitivity reaction in the form of the skin rash and fever. It can cause diarrhea because it can suppress the normal flora as well. And it can cause bone marrow suppression, and it can lead to severe aplastic anemia. And the most dangerous adverse effect of this drug is the gray baby syndrome. You know, the gray baby syndrome is occurring in the newborns infant if the mother uses the chloramphenicol, or if this drug is given to the baby, the baby can develop the gray baby syndrome. Its development usually occurs because of the deficiency of an enzyme what we call as the UDP glucuronide transferase. This enzyme is responsible for the metabolism of the chloramphenicol in the liver, but in infant and child there is deficiency of this enzyme, and usually there is more accumulation of the chloramphenicol, which lead into the gray baby syndrome. You know, what are the signs and symptoms of the gray baby syndrome? There will be feeding, there will be weakness, there will be pale appearance, and there will be abdominal distension and hypothermia. So what is the treatment of that gray baby syndrome? You just withdraw the drug, don't use this drug, then exchange transfusion may be one of the options, and give appropriate oxygen therapy, ventilation, intubation, and feeding. This can be the only treatment option for the treatment of the gray baby syndrome. So with this, I came to the end of another presentation on the chloramphenicol. If you have really enjoyed this video, I request you to subscribe my channel and follow me for more video. You share this video with your other colleagues and through other social media platform, so that it can reach to a maximum number of people, and so that they can understand better about the pharmacology. Thank you very much. God bless you all.